are getting just as sick and going in the hospital and spreading the virus. Let's all unite together. How hard is that? Is it that hard? And anyway, 7:39, Wednesday, September 8th, 2021. Let's go in with Chima Mbakwem, the Chief Public Health Officer for the Department of Public Health and Social Services. Good morning, Chima.
Good morning, Chris. Morning, Sabrina.
Good morning.
Well, where do you want to start, my friend? We're just going to give you the floor right now. You just tell these people what you think they need to hear.
I think we're still seeing an increase in the number of cases, and we're also seeing a huge number of recovery. I think yesterday my team was able to clear more than 450 releases of people who actually went through this and did not even get into the hospital. So that is a good sign, and people are actually getting better without getting into the hospital. But those that are in the hospital, we're also seeing releases from the hospital. So there's still, a lot of good things going out there while, we're still having this surge.
How much is that attributed to the administration of Regenco?
Is it with recovery or with hospitalization?
I'm sorry. Yeah, hospitalizations. Like because you started offering the treatment or making it more accessible over at the carnival grounds in Tizen, right? I guess that the doctors can make a referral.
Where they actually do the referral to the clinics. We're getting feedback, in our meeting yesterday. I listened to Dr. Cruz talk about individuals who actually received the treatment, and they're giving feedback to the doctors because they are the ones actually taking care of that. So they would have more information about feedback from the patients who got the treatment. But with the little I heard yesterday, there's good news coming out from there. And also, we met with the HHS on Saturday to discuss about the deployment. So they actually gave us an estimated time of arrival, which might be sometime next week, hoping that everything works out well. So we're going to have increased access to members of the community that would need the Regeneron treatment.
And that HHS meeting, that's part of the request that was made to FEMA for medical staffing?
Yes.
Okay.
Yes. Yeah. We just met with them to make sure that we smoothened it out. And the number was actually increased from a 20-man team to a 30-man team. So we have 30 people coming for the treatment, not 20 as we estimated.
How many? I'm sorry. What was that?
30 people. That's 6 doctors, and it's a 5-man team, and we're going to get a six teams of 5-man team.
Does that include the vaccinators? I remember you were mentioning you having
the vaccinators are different.
Separate.
And the laboratory support is different too.
Okay, could we go over the vaccinators on when they're supposed to arrive and how many?
No, we're expecting 20 vaccinators, and we're still hoping that by next week we should have traction. Yeah. But the request was put in last week, and it takes at least 14 days for them to get to Guam, if approved, which I know. Yeah.
And then the public health, you mentioned the lab.
Yes, we actually asked for laboratory support too, and we asked for 4 individuals to support in the lab. We're hoping to get at least 2 or 3.
And what will they be doing? They'll be helping with running the tests?
Yeah, that's the testing. The lab has been running, every day for almost since March of last year, so we always get support, when we ask for support from HHS. So we actually asked when we had this surge, we had to ask for support, and we were hopeful they are going to send us individuals. So I think we're going to have an increased capacity next week. And yesterday, we also met with the DOE nurses. So the DOE nurses are going to start off today with the department, and we've actually had schedules for homebound vaccination set. So they are going out to support in the homebound vaccinations, and then they're going to also support in case investigation. They're going to support us in the testing site at Tizan and the community health center.
How many DOE nurses?
All the DOE nurses.
Okay. So you're shifting them because of the situation with online learning, right, and the closure of the schools?
Yes.
Okay. And I wanted to get back to RegenCove. Is that it is Regeneron, or is it RegenCove? Just want to make sure I'm clear on if it's the same thing.
It's the same thing. It's the same thing. Yes.
Okay. All right. So, how long? Because we see that public health is trying to make it more accessible out into the community. How long have we had Regeneron? I know that we've talked about this last year because GMH was actually administering Regeneron along with that Vamlani
VMOB.
Yeah.
Yeah, GMH had a process in place, and then, when the cases started coming down, there wasn't any, there wasn't really a need for this kind of massive response, for the use of the drugs. But with the Delta variant and how quickly it spreads and the number of people getting infected, that need to have this more proactive reaction, actually came in place. And good thing that we started this conversation with Commander Okumura of HHS. I think it was late July, or I think mid-July, before this surge, about the need for Guam, to explore the need to use the Regeneron treatment. And good, I think we started that conversation with him. And when we started having the surge, then we actually activated the process. So that's why you're seeing it, because at the same time, this was happening, Guam's cases were low, but in other parts of the U.S., they had high number of cases. So all these deployments were actually going to all those states. But good, I think that we got into the conversation. So when we had the surge, it wasn't a new discussion. It was just a continuation of our prior discussions to provide that support to Guam, which they are actually working diligently to get us to have.
So the discussions began in July. So when did we get like a whole big shipment of RegenCove from FDA or?
No, so like I said, GMH is actually doing this already, right? Mm-hmm. But if you look at our cases, that period, it was just like in the low digits, 10, 15. But the anticipation of a surge, which was imminent with the Delta variant, we actually started working with HHS, to prepare for the surge. So we didn't have the supply on the island then, but we were discussing on how to get it here quickly if we had a surge. So now that we have a surge, that's what we're working to. That's what we're trying to get to the island as quickly as we can.
How many doses of RegenCove did we get, and when did we get it?
I think that should be for the hospital too. That information will be with the hospital because they are the ones ordering the RegenCove. But now public health is stepping into to support the private clinics to actually set up our own site, which we are trying to set up with HHS, the FEMA team. So that is just us public health supporting the RegenCove treatment. Remember, is a clinical treatment. It's just not prevention. Basically, is treatment, and it has a prevention component, which is the post-exposure prophylaxis, which we would also get into. But first of all, we need to take care of the people who are sick and who actually qualify for the treatment.
Great. And so you've got the 5 teams, right, that are coming in possibly by next week. So where are we going to set up these sites then, where people can get the RegenCove treatment? I heard you, might have been Art, at the oversight hearing, that it's being offered at GMH, and it went also online at GRMC. That was last week Friday. So are there any other sites? Because you said 5 teams. So does that mean they're going to open up 3 more sites to get RegenCove?
Yes, we're actually at the point of identifying those permanent sites for the administration. We met yesterday to look at the options we have. We actually listed some options, on where we can use for the treatments. But that conclusion would have to be before the end of the week, because we need to be sure, because of the weather, it's a concrete structure. We don't want people to be out there in the rains. We want to make it sustainable for people. So we met yesterday. We're going to meet again this morning, to make sure that we get it right. But the fact is that when we get it right, and it's too early for us to announce because these guys, the FEMA team is not here. So we're going to make sure that we identify those structures, make sure they are conducive enough for the treatment, and then we'll be able to announce it even before the team arrives.
Mm-hmm. And just so I'm clear, the team that's coming, are they doing are they administering the RegenCove through a shot or through an IV?
The female team will be using the shots.
So okay,
the subcutaneous shots. Yes.
Okay.
That's basically what the team will do. Yes.
Chima, so there isn't a shortage of RegenCove on island, right?
On the island?
Yeah.
I don't understand the shortage. We actually the hospitals are the ones ordering it. Okay. So, and I think they have orders that are placed that are supposed to arrive anytime soon. But I think they are still treating people with RegenCove.
But they're waiting on an order?
Yeah, they're waiting. Yeah. The thing is that there's this is actually being asked for by every jurisdiction.
Yeah.
Yes. So. Yeah.
No, that's what I'm asking, Chima, because we saw early on in the pandemic, I'm sure there were shortages in masks, PPEs, and as we kind of get deeper in and people start to really look at recovery, like you said, I'm pretty sure there's an increased demand for RegenCove and all these other monoclonal antibody treatments. That's why I was asking if we have enough supply on island.
Yes, so we I think with the clinics, the hospitals have enough, but public health is stepping in, to actually order some more for the team that is coming. And the good thing is that there's an increased demand for for the treatment, which is a good sign, and then that will really help us in keeping people away from the hospital.
So do you know how many doses we have currently in stock?
No, that would be for the hospitals.
No, but public health is ordering, right? So does public health have any RegenCove?
We don't have any RegenCove now. As at this moment, we don't have any.
But you're expecting a shipment?
The hospitals are actually expecting their shipments, but public health is ordering. I was actually talking to the HHS liaison on island, about the process. I spoke to the pharmacist yesterday, so we're going to have that completely, ordered today.
So it sounds like there is a shortage.
Shortage on
the RegenCove
in the U.S.
I mean, we're hearing like there's 10 doses left or something, but we're trying to get hold of Lillian. I just figured you would know.
No, I think that the clinics, the hospitals will be, I think, the best to answer that.
Okay.
So again, next week, the arrival of the team from HHS for these RegenCove community sort of like clinics right outside of GMH and GRMC. And public health is going to order the doses of RegenCove that will be used at those community sites.
Yes. So we're, is a kind of we're trying to expand access, to to the treatment, just not concentrating on the hospitals. We're also looking at having outlets where people can access the treatment.
Why don't we have them now, though, if we're trying to start this next week?
Why don't we have
the RegenCove for these community sites?
We have to order it and then have the people to.
But are we going to
administer it? Yeah.
So when they get here, are we going to have any RegenCove for them to work with? If we're waiting on shipment?
Definitely, it's the same. The same people coming to administer it are the same people who are going to give it to us.
Okay, gotcha. What about testing, Chima? We've been talking over the last few weeks about, especially because we did that pivot where you're telling everyone to go out and get tested, but the line at Tizen, we just get a lot of complaints about, well, not complaints, maybe that's not the right word, a lot of statements from people who say that they're waiting hours to get tested. And I know you had talked about on this show that you guys were trying to open up more testing options for people.
Yes, but I think the clinics are actually stepping up now to support us in that aspect. I think yesterday, I think I got a report that the Guam Radiology actually tested up to 400 people, because they asked for extra testing platforms from public health. I think that is commendable in the sense that we're seeing people who are not only going out to stand in line but also trying to assess testing from their private physicians. So the discussion last week was opening up another test site. But I told you about the challenges that we have, identifying the place. But we are still looking at that option, because when the FEMA team actually comes on ground, it's going to relieve some pressure from the nurses, and also help us push more resources towards testing.
So is Guam Radiology, is that another public health testing site, or?
No, we partner with private clinics. AMC is testing,
right, yeah.
GRC 7-day. The SDA is testing a lot too, and FHP, I think, yeah. So a lot of the private clinics are really, because people are going to see their private physicians too, and they are getting checked out there too.
Is the testing supposed to be free when you go to the private clinics?
Yeah, I think it's free in the sense that for those who have insurance, the insurance actually pays for the administrative fee, but the cost of the test is free.
One thing you've said on this show in the past is that the numbers tell a story. So when I look at the numbers, for example, for the hospitalizations and, the unvaccinated versus the vaccinated, like at GMH over the weekend, it was 25 vaccinated, 25 unvaccinated. Last night's JIC, it was 18 unvaccinated, 14 vaccinated. At GRMC, it was 13 unvaccinated, 11 vaccinated. What do these numbers say? What is the story?
So I think we should just step a little back from like the comparison of vaccinated and non-vaccinated hospitalization and all that, because what we're looking at, if you're looking at the number of people who are vaccinated on the island, there's a huge number of people who are vaccinated, and like I mentioned earlier, the virus actually the vaccine does not cure, it doesn't limit transmission. So, and also people have other underlying illnesses that take them to the hospital, and they get tested for COVID. And I think I had a brief chat with Chris on that, about, people being in the hospital, reasons why they're in the hospital, what symptoms brought them to the hospital. So that is something that, it's going to take some time, because that information will have to come from the clinic, to look at what those numbers are. Because most times you might have underlying conditions, and you go to the hospital to go see a doctor, and you get tested for COVID, and that becomes part of your diagnosis. But going into the hospital with COVID, or you have a condition and you go to the ED, and then they test you and it's COVID, and you're also having severe COVID symptoms is another way of looking at it. But what we're trying to say is that the vaccines actually offer you more protection than the unvaccinated, right? So the fact that people are ending up in the hospital, we know about the breakthrough cases, which is consistent with what we're seeing in every part of the world. But the good thing today is, let's look at where we are today and where we were at the same time last year. Last year, the island was completely shut down at this period, completely shut down. And like I mentioned earlier, the cases were more of congregate settings. We were seeing cases in the prison, we were seeing cases in the barracks. The island was locked up, and we actually, we had a community quarantine, and we had no movement within the community. And at that point, there were no vaccines. But push forward to today, we have the vaccines, the island is open, the restrictions are not as stringent as it was last year, and then we're still having this level of community spread. So if you're comparing, it shows that the vaccines are working because people are not ending up in the hospital the way they were ending up in the hospital last year. This strain of the virus is more aggressive than the strain of the virus that we had last year. So I think we just have to look at it, more broadly to understand the fact that yes, we're seeing people in the hospital because of COVID, but the fact remains that we have that added protection from the vaccines to show that we can at least stay open today. So let us also look at the fact that we are open today as a community, not in quarantine because of this number of cases. So that's why on public health side, we're saying, please go out and get vaccinated, wear your mask, continue to keep your distance, so that we learn how to live with the new virus, with our new norm. So that is the messaging. So just looking at the numbers and comparing, vaccinated and unvaccinated in the hospital would actually take out, the amount of how do I put it? The amount of gains, that we've had with the vaccine. At least today we're open. Today the businesses are on. Today people are moving around, So
yeah, it kind of sounds like that's what the problem is, Chima. It's 8:01. We're gonna jump over real quick, and then we'll wrap with you on the other side. KUAM TV. This is the link on the Breeze side. We're KUAM FM, Agatni, Guam, Pacific Points, Cabo Enterprises, ITNE, and Jack in the box. Good morning. Good morning. Good morning. Good morning, Guam. Right on. Morning, Sabrina.
Good morning.
Good morning, Jason Solis.
Good morning.
Ladies man. Joe, sir, good morning. Good morning, KUAM TV. Welcome to the link. Miss the link, miss lots and lots, so don't miss it. We're in right now in the KUAM News Zoom room with Chima Mbakwem, the Acting Chief Public Health Officer, Superintendent John Fernandez. Coming up right here on the link, 8:03. Yeah, Chima, so you were basically saying, look at the difference between last year and this year. Yeah, and I don't know, a lot of people are saying that we're just as bad as we were last year, and we have the vaccines. So I know that you're trying to make the argument that, and I don't know, correct me if I'm wrong, are you just basically saying that this is the new norm and that this is acceptable to have 200 cases, 100 cases, 90 cases a day because we're not contact tracing, we're not doing any additional restrictions, we're listening to you talk about how we've actually made gains while we're sitting in this position that we're in right now. So help us make sense of it, because when I look out here and I see these high numbers and I see, schools shut down, face-to-face learning temporarily suspended, I don't necessarily see the gains. I feel like we're over the edge, down the other side, falling down the hill.
Well, Chris, I think your perspective is also acceptable, but the thing is that I think you need to look at April, May, June. You just need to look at April, May, June, and look at what the numbers were then. And then you also have to look across the world. We're talking about another variant. We're talking about something different, something more aggressive. We're talking about something that has actually shown to be more aggressive than what we had. And this is always a moving target. And we, as it moves, we try to make sure that we catch up with it. So today we're seeing this uptick in cases because of certain behaviors that we did not, certain behaviors that we're not really strict on as individuals that brought us to where we are today. But as a community, we've been able to fight this virus down up to February, going to June, and I think we can still do that. But if you're suggesting that if the insinuation is that we need to be more stringent in our restrictions, also look at the other school of thought, that is saying, you're going to shut down businesses, it's going to affect people's life, you're going to shut down the borders, people are not going to come in. Is how to strike that balance.
Yeah.
But I still go back to the fact that as of today, we have a new strain of the virus, very aggressive, but the same principles, the same concept of prevention and mitigation against new transmissions still remains the same. So it's just for us to go back to the basics, wear our mask, keep safe distance, get vaccinated, and then continue to practice all this, and then we'll be back to where we are in June. So that is the expectations. And then with the new treatment, people are going to get treated, and people are going to get better. The hospitals will not be flooded with COVID cases, and then we just have to start living with the situation until something is done across the world. It's just not us. It's the same everywhere in the world.
Yeah, no, that's why I see these waves that we follow, and I just feel like right now we're already killing these businesses. We're killing them because of these restrictions that are in place. People just everywhere I go, Chima, and I'm not saying like I'm out there partying or anything, but when I go around, I always make sure I talk to people. And what I'm hearing is that a lot of businesses are seeing reductions of 30 to 60%. So the businesses are already dying, right? I mean, they are. Let's just be honest, they are. And we're looking at PUA running out. So at what point do we kind of say, hold on, let's just stop the hemorrhaging and go down in a hole for 2 weeks? Because I get what you're saying about this year and last year, but just riddle me this, right? People are saying, why don't we do what worked last year? Because we're in a bad spot now. We have the vaccines. Why don't we go back to doing what we did last year to stop the spread, which was, was like lockdown, takeout only style of restriction? Or are you just saying again that this is totally acceptable? Because if it is, then we need to know that, because we're out here pushing the message.
No, so Chris, like I said, these are different schools of thought. People are actually saying, stay open. People are saying stay closed.
Right. Yeah.
People are not going to the restaurant because they don't want to be in crowded places. I know a lot of people that will never go into any restaurant if it's not outdoor. They are fully vaccinated, wear their mask, but nobody wants to take that chance of getting infected with the new strain of the virus that is more aggressive than the former strain. So these are decisions that people are making on their own. So the restaurants are open, and people are open to go to the restaurant. But the fact remains that when people are making those choices, their personal choices. But the fact that the restaurants are not shut down is not what is basically driving the transmission. But it's also people's behavior and attitude that would also be part of it, because the virus is transmitted by human beings.
Yeah.
Like if we cover our nose, we protect others. If we have the virus, if we don't have the virus, we protect ourselves from others who have the virus. So basically, that is the concept of wearing a mask, so that you limit transmission. So I think those are things that we need to put in perspective when we're discussing this. There's a school of thought that wants the island shut down. Yeah. There's a school of thought that want it open, balancing it is what we're trying to do, with the restrictions in place, to actually limit new transmissions. We're still fighting with the old transmissions, with the things going on. And I spoke to my team this morning, and the question has always been, are you guys seeing transmission in crowded places? Are we getting anything, out there, like restaurants where you're seeing a lot of cases? No. We're still seeing them, in the family units, where, like I always said, people are less conscious, the rate of transmission is so high, is less than 3 days to get infected, or 4 days, But like I said, in the coming weeks, we have all this, remedies in place, starting soon, to see how we can effectively, stay open and also drive down the new transmission.
When you say those remedies starting soon, are you talking about the Regencove? Yeah, okay.
Yeah, the treatment, yes. Because so you can imagine now, so we started with the non-pharmaceuticals. Nobody knew anything about COVID. The scientists were out there. And one thing people don't even understand is that, like a lot for COVID, there has been up to 400 EUAs, approved just for COVID alone, which has been the highest EUA approved for any kind of epidemic, because there were EUAs on testing kits, there are EUAs on medication, on gowns, because it is, like the pandemic is so massive. I think if you look at what is going on around us in the world, you can see the rippling effect. Look at the Philippines, their cases. Look at Japan that actually had the Olympics. Look at their daily case rates, So it is the same across board. And the message has been consistent with WHO and CDC and the local public health agencies, to try and say, first of all, we didn't know what to do. It hit us so hard. We looked at the non-pharmaceutical preventions by using mechanical barriers, wearing the mask, washing our hands, to getting a vaccine. Now, from getting a vaccine, we're now actually getting a treatment, So I think with every other day, there's light at the end of the tunnel, and we keep pushing to see, how we get to the end of this. And then I think it's encouraging, but the thing is, for us to limit, new transmissions as a community, is just to make sure that we do the basic, wear the mask, protect ourselves and others, and then get vaccinated. If you get sick, you go get the Regencove treatment, and then keep our hospitals open for people who have other, conditions that are not basically COVID. And then I think we'll be able to live with it as long as we can.
Thank you, Chima.
Thank you so much.
Wait,
I just wanted to ask about the talk now. We've done a lot about the Delta variant, but what about this Mu or MU variant?
Yeah, it's a new variant of interest, but I think good thing is not coming this way, and is being watched.
That's what you said about Delta, Chima. That's what you said about Delta. I got it on tape, man. Be easy, my friend.
Any new transmission can be cut off by just wearing the mask, and just washing your hands and keeping your distance. That's basically what it is. I wear my mask.
Hey, don't look at me. I'm COVID free, bro.
So
he's like, why you got to bring up old stuff?
No, like I always say, there's always this looming, it's always out there, and the more we stop new transmissions, the more we protect ourselves from the new variants. Yeah, because like the virus will try to mutate, to try to figure out how to break our defenses. But if we make sure that we don't get infected, then it's not going to see anywhere to play those tricks.
Right on. That's why a lot of people think we should go back to the stay home. Right on.
Is public health providing any input on the president announcing last week about this new pandemic preparedness plan. No.
What new pandemic? I don't think
there was a announcement by the White House that the Biden administration, they were working on this new pandemic response plan for the future. So I just wasn't sure if public health was going to provide any input on, like, for example, how we handled the pandemic, because we always say Guam did so well. Or
Man, that was a jinx. Don't ever say that again.
No, Chris, we're as a community, we're doing very well.
Which one is it? Are we spreading the virus all over, or are we doing well? It's okay.
No, we're as a community, we're very good. Sometimes you sleep, and then you catch yourself, and then you do what you need to do.
Right.
There are lots of positive people on the island, and
Positive COVID.
If you listen to the legislative hearing and the encouragement from the senators, and the support that we have, and the need and the need for us to be a little more, consistent with our messaging and information which they asked, to help the community make decisions. That will show you that, as a community, we are actually coming together, the executive, the legislative arm, we're all working towards, trying very hard, to keep the community safe. And I think at this point, we just need to applaud ourselves for what we're doing. Yes, we're seeing these cases. Yes, people are changing behaviors at home, but the results will come out, sooner than later. But I think the resilience, as a community to remain safe and strong is something that, we really have to appreciate as a community.
And just real quickly, you mentioned this HHS liaison. Is that a new person? Is that somebody that's from Guam, or somebody that flew in from HHS?
Or is it someone that was here, was activated?
He's here. He's here, but he's been actually activated to work, directly with HHS to support us.
Who is this liaison?
He's Captain Bearden. Yeah.
Captain Bearden?
Yeah, Brian Bearden.
Brian Bearden.
Brian Bearden. See, Brian, I mean Bearden.
Oh, no, that name sounds familiar.
Yeah, he's a captain.
Okay.
Thank you, Chima.
Thank you so much for having me. And
No, it's really good having you talk. It's always, we like it.
Thank you so much.
Can you
Thank
work
you.
on getting that the info I sent, whatever? I know the GMH will provide some of the vaccine info I asked you for, but then whatever you guys can provide on the public health side.
Yes, yeah. Okay. I mean, like I told you, I was going to work on that. And
thank you. Appreciate it. Appreciate it.
All right. Thank you so much.
Okay.
Thank
See you,
right.
Chima.
Thank
Take
you.
care.
Have a good day.
Right on. There you go. 8:17. Let's go ahead and get it right into the news, shall we? Superintendent John Fernandez is coming up here on the link. It's Wednesday, September 8th.